in faraway northwestern state of Kaduna, where the death toll from diphtheria outbreak has risen to 17, with 68 suspected cases identified across the state as of Sunday. This is the latest information from the Kaduna state government. The government says out of the figure, 14 deaths were recorded in the Kafanchan, Jema local government area, while 3 fatalities occurred in Makarfi, LGA. The chief epidemiologist of the State Ministry of Health, Dr. Jeremiah Daiko, explained that the results of 20 samples that had been collected and sent by the ministry for analysis were being awaited, while the 48 cases on admission were in stable condition. While breaking down the figures on the active cases, Dr. Daiko said 12 patients were on admission at the General Hospital in Makarfi, 35 at the Kafanchan General Hospital, and 1 patient at the Kuba Primary Health Center. Recall that the index case was a 4-year-old male child whose illness started on the 4th of July in Jema local government area. Well, to walk us through this development, let's bring in the chief epidemiologist, Ministry of Health, Kaduna State, Dr. Jeremiah Daiko, who has been monitoring this development from the very beginning. Dr. Daiko, thank you for joining us on TVC News at 1. 17 deaths in the index case of diphtheria was reported in Kaduna. Talk to us about the outbreak and symptoms to look out for.
Yes, thank you very much. The outbreak of suspected diphtheria started about 2 weeks ago, and with the cases were reported and last week. And since then, the surveillance officers and the rapid response teams have been on the field to actually identify these cases and take them to the hospital for management. So far, we have detected about 68 suspected cases with 17 deaths. And 4 LGAs have reported cases of 51 cases from Jama, that's Jama local government, with 14 deaths. We also have 15 cases from Makarfi local government with 3 deaths, and also have recorded 1 case from Kubau and 1 case from Kaduna South. Thank you.
Let's talk about symptoms of diphtheria. What should we look out for? How do we know when someone has it?
Yes, the symptoms of diphtheria include, it may start with fever, sore throat in the mouth, cough, swelling in the neck, difficulty in swallowing, and also as it progresses, it can lead to difficulty in breathing. So these are some of the symptoms of diphtheria.
And how is it contracted?
Yes, the disease is contracted when somebody comes in contact with somebody who is infected, or through the vomiters, or through the true cough, when somebody coughs and maybe somebody is close to the person, so you can contact through spots from the mouth of the infected person, through contact with the infected person. So that is how it is contracted. Or through the skin of maybe somebody who is infected, you come in contact with the clots or the skin of the infected person, you can pick the bacteria from there also.
All right, but then what really is the root cause of diphtheria?
Yes, the root cause may be if maybe children who are not vaccinated, because really we have vaccination for it's a vaccine preventable disease. And normally we vaccinate children. There's a vaccine that's supposed to be penta vaccine, which is usually given at 6 weeks, 10 weeks, and 14 weeks. So some children are not vaccinated, or some communities are not compliant with vaccination, they refuse vaccination. And in those communities, of course, the children, if the immunity goes down, they may have the disease. So it's mainly due to lack of vaccination or poor vaccine in those communities that refuse to collect vaccination.
And what are the chances of survival for those who test positive?
Yeah, the chances of survival, if the children are moved to the health facility early, the disease is detected early and are moved to the health facility, those people can be treated and they'll get better. But the problem, if it's not detected early or children are not moved to the facility early, well, complications will set in. And once complications set in, the chances of survival become very poor.
So it means that this is prevalent among children?
Yes, among children, yes.
All right. And what is the state government doing now to ensure that you're able to manage it and it doesn't degenerate any further?
Yes, what we are doing at the moment is a community sensitization to sensitize the community that if they see reported any of these symptoms, they should take the person to the hospital immediately. And also, we are planning to vaccinate those communities with all routine vaccination, with zero-dose vaccination. So we're trying to vaccinate the community. So awareness is going on at the moment everywhere in the community. And also, we are moving the people to the hospital. And the hospital are on top of the game. Those in the hospital now are doing very well. They are being treated very well. And we hope that as we move more cases to the facility, they'll be treated and they will be discharged. Thank you.
All right, then. And then it will be important also to just, take this across to other states too, because it's just very easy to move from one state to the other, and you never can tell if the person you're coming in contact with already has, diphtheria. All right, then. Chief Epidemiologist of Ministry of Health in Kaduna State, Dr. Jeremiah Daiko, thank you for talking to us on TVC News at 1.
Thank you very much. Thank you.